Welcome to our video debate. Our topic is digital health case. So I will talk about first. I will talk about the negative about me- the digital medical service. So the commercialization of digital medical service will lead to uneven uh, distribution of medical resources. Uh, m- most of the people living in the big city, especially in the New York or Beijing, this kind of modern city, they can get a more digital medical service. However, the people who live in the countryside, such countryside or in the remote area, they can't get a good digital medical service. So I think the digital medical service will lead to uneven dis- disp- distribution of medical resources. So next one.
Good point. But what I want to emphasize is the benefit of the transparency and accessibility in healthcare that digital technology can bring. So these issues can be addressed by implementing robust security measures and regulations, such as electrical health records. It will allow healthcare providers to access a patient complete medical history, including their past diagnosis, treatment, and test results, which can help to avoid the errors and duplicate tests. Uh, Another point is that for the patient, even the remote areas, they can acquire the more because this industry you don't need to take the doctor in person, and it will reduce the cost and will provide more convenience for these people, even for the whole industry. So my point is digital healthcare technology can improve the healthcare industry and lead to better healthcare outcomes and efficiency. Oh, that's all. Thank you.
Next one.
Okay, hi.
Hi.
Hi. Hello.
Hello.
Welcome. Today I'll be talking about the importance of digital healthcare. Digital healthcare, also known as e-health, is the use of digital technologies to improve healthcare services. It includes the use of electronic health records, also known as EHR, telemedicine, mobile health, or other digital tools to enhance patient care. One of the main benefits of digital healthcare is that it can increase access to healthcare, especially in rural and remote areas. Patients can communicate with healthcare providers, access medical information, receive diagnosis, treatment plans without leaving their home. This saves time and money and improves outcomes for patients with chronic conditions. Another advantage is it improves the quality of healthcare. EHRs, that means electronic health records, allow healthcare providers to easily access and share patient information. We can share from Halifax to Wolville, from Toronto to Wolville, from anywhere. We have access to it online. Telemedicine allows specialists consult with primary caregivers, which leads to more accurate diagnosis and treatment plans. Finally, digital healthcare reduces the health cost by providing efficiency and reducing unnecessary procedures. Patients can use their mobile phone apps to access basic digital healthcare needs, basic healthcare needs, rather than waiting on somebody arriving at their doorstep to do it for them. So by investing in more digital technologies, we can improve patient outcomes and create more efficient healthcare system. Thank you.
Hi, I'm Rosemary and I'm here to talk about the digital healthcare. Basically, how digital healthcare may negatively impact employment and human resources in the healthcare industry. First of all, digital healthcare has a lot of benefits, which we can all basically agree on, but it also has its various disadvantages. And the biggest concern when it comes to digital healthcare just has to be the human, like when it comes to digital healthcare, has to be cybersecurity. Data processing basically has a huge impact to do with it. Data processing, because hospitals and similar platforms collect an enormous amount of delicate data. And the cybersecurity with any other digital platform is a major issue in the digital healthcare. Now, according to a presentation which was done by the VP of Product Marketing, Chris Dobrik. Yes, Chris Dobrik. When it comes to medical healthcare security and the internet, poor cybersecurity possesses both a negative impact on patient safety and the infrastructure that keeps the hospital running. That's what you call a classic double whammy. Basically, a double whammy when it comes to that means that it impacts both the patient and the hospital negatively. So both parties are impacted very negatively. And for example, when it came to during the pandemic, it gave a lot of time and space for cyber criminals to increase their attacks because of the vulnerability of healthcare industries. Another challenge is digital literacy. Digital literacy is another very great challenge because among patients and the resulting unequal access to healthcare to issues related to the data storage, access, sharing, and ownership. These concerns in turn raise very important privacy questions. Example, what if medical devices are hacked? What exactly happens to the information and data collected by the hospital? It's open to anyone and can be accessed by anyone, which brings a lot of vulnerability to the hospital and the patients. Another thing is when robots are used in surgery, who exactly is to be blamed? Are we going to blame the people who used it, the programmers, or the doctors? So basically, what I'm trying to say is yes, we know that machines and technology is 99% efficient, but the people who program them are prone to mistakes, which brings a lot of disadvantages and negative impacts on the human resources. Thank you.
Okay, thank you. Now is the question time. So do we so do you have a question about for each other? Well, I have a question I want to ask Wei. So the digital health requires expansion ex, expansion patient's patient's personal privacy. So how to do that?
Okay, as far as I'm concerned, even for now, some paper-based issues, it is more for the digital health in care. We use technology is more efficient and is better secure for our paper-based. Even though this match may also be lost, but we still can trust this technology in the future. So I don't think it's big issues. Thank you.
Okay, thank you. And have another question? Do you have another question? So it's no question now. Our our video debate is over now. Thank you, everyone.
Thank you.
Thank you.
Yeah, beautiful, perfect.